Studies show that the average woman gains up to 10 pounds during perimenopause, with some gaining much more. This weight gain is not just from eating more, it's caused by hormonal changes, slowed metabolism, loss of muscle, and lower physical activity. So let's talk about 5 FDA-approved medications for weight loss. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. You may have been gaining weight around your middle section despite healthy attempts. You may have tried every diet and still can't lose those stubborn 20 pounds. So why does your body feel like it's betraying you during perimenopause? When estrogen drops, your body starts storing fat differently. Instead of just your hips and thighs, there's a focus on your belly. Your insulin becomes less effective, your appetite hormones go haywire, and your metabolism slows down like traffic during rush hour. I see this every single day in my practice. Women come in and saying, I'm doing everything right, but nothing works anymore. And you know what? They're absolutely right. The old rules don't apply when your hormones are in free fall, which is why I'm about to share 5 FDA-approved medications that are revolutionizing weight loss. These aren't quick fixes. They are tools for a chronic condition that requires long-term management. Just like we treat diabetes or high blood pressure, obesity and perimenopause needs ongoing support. Let me break down each medication so you can have an informed conversation with your doctor. First up is Orlistat. Think of it as a bouncer for your digestive system. It blocks enzymes from your stomach and pancreas, reducing the absorption of fat. You may lose about 5 to 6% of your body weight over a year. Side effects include stomach discomfort, fatty stools, fatigue, and dizziness. It is advisable to supplement with fat-soluble vitamins A, D, E, and K. Next is the combination of phentermine and topiramate. This is where things get interesting. Phentermine suppresses your appetite by affecting your brain's hunger signals. Topiramate, originally an anti-seizure medication, also reduces appetite and makes food taste different. They can be used individually or combined for more effective weight loss. Together, they can help you lose 9 to 11% of your body weight. That's significant. But they come with side effects like tingling in your hands and feet, dry mouth, and trouble sleeping. And if you have heart problems, high blood pressure, or glaucoma, this isn't for you. The third option is naltrexone combined with bupropion. This combination, known as Contrave, is fascinating from a brain chemistry perspective. Naltrexone blocks opioid receptors, which reduces food cravings. Bupropion affects dopamine and norepinephrine, the same chemicals involved in depression and addiction. People taking Contrave typically lose about 5 to 8% of their body weight per year. With an intensive diet and exercise along with Contrave, weight loss can reach up to 11% in some cases. An important benefit is how it changes your relationship with food. Many people feel like they're in control of their food intake with this medication. Now here's where the game changes completely: the GLP-1 receptor agonist. Liraglutide was the first GLP-1 receptor agonist approved for weight loss as Saxenda in 2014. It slows down how fast food leaves your stomach and tells your brain you're full. You inject it daily under your skin, and you can lose about 7 to 8% of your body weight over 1 year. Some people may lose more, but then came semaglutide, Wegovy. Same mechanism, but you only inject it once a week, and the result, a 15% weight loss over 16 months. That's approaching what we see with bariatric surgery. But there's more to this medication. Semaglutide isn't just about weight loss. It's the first and only weight loss medication approved for reducing cardiovascular risk. In people with obesity and heart disease, it reduces heart attacks and strokes by 20%. Think about that. We're not just talking about fitting into your favorite jeans again. We're talking about potentially saving your life. And then there's tirzepatide. This is the newest player, and it's a game changer. It targets not one, but 2 hormone pathways, GLP-1 and GIP. The result, an average of 21% weight loss over 16 months. This amount of weight loss is higher than that of any other approved weight loss medication. It comes close to results seen with bariatric surgery. Let me put that into perspective. If you weigh 200 pounds, that's 42 pounds. That's life-changing weight loss without surgery. But here's what I need you to understand. These medications aren't magic bullets. They're tools that work best when combined with lifestyle changes, and they require long-term use. In Nigeria, we have a saying: the tree that will grow tall must be watered consistently. Your health is dietary. These medications are part of the watering system. Now let's talk about cost, because this is important. Semaglutide and tirzepatide can cost over $1,000 a month without insurance. That's a mortgage payment for many families. Some savings cards can bring this down to about $300 to $500 a month. The other options may be cheaper, but remember, the most expensive medication is the one that doesn't work for you. Here's something crucial for women in perimenopause. Research on these medications, specifically in midlife women, is limited. We need more studies, but what we do know is promising. One study showed that postmenopausal women on hormone therapy had even better weight loss with semaglutide. The connection between hormones and these medications is an area we're just beginning to understand. And here's a concern I have as someone who treats midlife women. These medications can cause muscle loss along with fat loss. During perimenopause, when you're already at risk for sarcopenia, this is something we need to monitor carefully. That's why I always recommend strength training and adequate protein intake when using these medications. You want to lose fat, not muscle. Now, you might be wondering about side effects. The most common ones with GLP-1 medications are nausea, diarrhea, and constipation. Usually, these improve over time as your body adjusts, but there are some serious considerations. If you have a personal or family history of thyroid cancer or multiple endocrine neoplasia syndrome, these medications aren't for you. Here's the fact you need to know about. When you stop these medications, the weight usually comes back. Just like when someone with diabetes stops their medications, their blood sugar goes up. Obesity is a chronic disease. It requires chronic management. We don't shame people with diabetes for needing insulin. We shouldn't shame people for needing help with weight management. The key is finding the right medication for your specific situation. Your doctor will consider your BMI, your other health conditions, your insurance coverage, and your personal preferences. If your BMI is between 27 and 30 and you have weight-related health problems, or if your BMI is over 30, you might be a candidate for these medications. But remember, medication is just one piece of the puzzle. The foundation remains focused on lifestyle medicine and integrative care. Good sleep, stress management, regular movement, and nourishing your body with whole foods. The right supplementation is also key, and this next video talks about the top 5 brain supplements for women over 40.